Hi, I'm Dr. Tara Narula with some super quick tips about going into the weekend if you're worried about coronavirus. So, washing your hands with soap and water, warm soap and water for 20 seconds, using sanitizers, coughing into your elbow or your sleeve. Also, sanitizing or disinfecting surfaces that you touch a lot with things like Lysol or wipes that are recommended by the EPA. That will help to keep you from getting the virus. Another tip for keeping yourself from getting coronavirus is to disinfect surfaces. And lots of times we don't think about surfaces, but things like doorknobs, faucet handles, remote controls, iPads, iPhones, desktops, computers, mouses, anything that is a high touch area, you want to try to disinfect. One last really good tip, try to keep your hands away from your face. I know it's really hard, but we say keep your hands below your neck. When you touch your face with your hands, you have the potential for spreading viral particles to your nose, eyes, mouth, and getting the infection. I talked more about all of this on CBS This Morning, so swipe up to watch.
All right, we're live.
Hi, I'm CBS News medical contributor Dr. Tara Narula, and we're talking today about coronavirus, the coronavirus outbreak, which is on top of everybody's mind. We know that as of now, there are over 100,000 cases globally, so lots of fear around this topic. So we wanted to answer some of your questions today, so we will go ahead and get started.
Sure. The first question we got via Instagram is, how do you differentiate from a normal cold to a sinus infection?
You mean from COVID?
Yeah.
Yeah, so a lot of confusion about, do I have a cold, do I have the flu, do I have COVID-19? So for most people, a cold is going to be more upper respiratory. So congestion, runny nose, sore throat, maybe a little bit of a cough. For the flu and for COVID-19, a little bit more lower respiratory tract, and also fever is more of a predominant symptom. So sometimes it can be confusing to differentiate between fever and COVID-19 because both can have fever, both can have a cough, kind of muscle or joint aches or pains, headache. And then, one of the big features of COVID-19 is shortness of breath because it can progress to a pneumonia, which of course the flu can too. So sometimes it can be hard to figure it out, which is why we recommend, if you do have any concern, that you really do speak to your doctor and let them assess whether or not you should be tested for the flu or COVID-19 or both.
And real quick, we just want to let viewers watching right now, please drop your comments and questions in here. Tara's going to try her best to answer all of them. We also got one from Instagram saying, any particular vitamins or supplements, are they helpful?
Well, Gail just asked me about zinc lozenges. So, as of this point in time, there's really no supplement or vitamin that has been shown efficacious against COVID-19 or many other viruses for that matter. So we really don't recommend supplements or vitamins that help fighting against COVID-19.
There's a lot of discussion about, should I travel, should I get on an airplane? What's your guidance on that?
I think this is an evolving topic, and I think it really has to be a decision at this point in time that you make based on your concern, your risk factors. So certainly if you are someone who is elderly, who may have underlying risk factors like cardiovascular disease or diabetes, cancer, immunosuppression, it may be taking a little bit more of a chance. Obviously, you're putting yourself in a situation where you're in close contact with someone, and if that person is sneezing or coughing, you may get infected. So there are no statements as of now saying that you should avoid travel, but I think it has to be left up to the individual to make that decision at this point.
We have a question from Amy, who was actually watching us this morning. Thank you, Amy. She says, can you explain about the surface lifespan?
Yeah, so we talked about that on the show today, and again, we're learning more and more, but so far the best information we have says that it can live on surfaces anywhere from a couple hours to a couple days. So it is really important to disinfect, and the EPA did publish a 5-page letter that lists all the products that have been shown to be effective against coronaviruses, viruses that are more difficult to kill than coronaviruses. So I would say you can check that website out, but certainly Lysol products, Clorox products are big on that list. And it would be really important to make sure to disinfect things like remote controls, iPads, iPhones, doorknobs, anywhere where there are high-touch surfaces.
Elizabeth is asking, would wearing gloves be helpful rather than masks?
Right, that's a great question. I think if you can wash your gloves very, very often, you could certainly make an argument to wear them, but that is really a big factor, is you would have to make sure to wash them. If you're not going to wash them, then you're potentially still increasing your risk for infection. But certainly the masks are, not recommended, and we keep trying to reinforce that. And we don't want to take away the supply from healthcare workers of those N95 respirators. They're on the front lines. They're the ones that really need those specific masks. And those masks have to be fit tested. As physicians, every year we have to go to our health clinics and make sure that we know how to put those N95 masks on appropriately and that they're fitted well to our face. Because if they're not, the viral particles can still get through. And also, it can actually increase your risk of infection if you're futzing and fidgeting with the mask and touching your face. So it's really not recommended for the general public.
Can you talk about that real quick about touching your face? I saw something like people touch their face like over 1,000 times a day. Can you help stop that?
It's really, really hard. I talk to my kids about that a lot too. It's just a habit that a lot of us have, but certainly we know that if those viral particles are on your hands and you're touching your nose or your eyes or near your mouth, you have the potential of infecting yourself. So you do want to try, in addition to washing your hands for 20 seconds with soap and water, using sanitizer, to really keep your hands kind of below your neck if you can.
Kathy says, I'm 62 and have chronic lymphatic leukemia. My husband and I go shopping a lot. Is there any advice you recommend for them?
And we talked again this morning on the show about this concept of social distancing. And this is a public health measure that is utilized in epidemics to kind of slow the advancement of infection and to decrease the risk to individuals. So I don't think it's a bad idea, if you are someone who is at higher risk, to try to avoid settings where you might be congregating around lots and lots of people. So obviously, if you're shopping in an area where there's not a lot of traffic, not a lot of people around you, it's probably okay. But if it's a very tight, closed quarter setting where there's tons and tons of people, you are, again, increasing your risk a little bit of exposure.
Is there any guidance about how long the typical length of this illness is lasting for people?
Yeah, we do think that for most people, again, 80%, this is going to be relatively mild, kind of cold-like symptoms, fever, cough, and then people will get better over a couple weeks. But certainly in those more severe cases, the duration of symptoms could go on much longer. So it just depends on how you respond or react. But we do know that the incubation period, which is the time from the time you get infected to the time that you show symptoms, has a range, and that range is anywhere from 0 to 14 days, on average about 5 days, which is why we're telling people that if you're concerned, you really should self-isolate for that 14-day period, because that is a window of time where you could be infectious to others.
Our viewer Prince is asking, what's the difference between the Ebola virus and coronavirus?
Oh boy, a big, big difference. So, and this is one of the things that we're trying to get across to decrease panic, which is, when you look at the case fatality rate, which is the number of people that die from infections, and that's how we kind of tell how scary it is, the case fatality rate for Ebola is almost 90%. So if you get infected with Ebola, your chance of dying is very, very high. Coronavirus, we're thinking that the case fatality rate is somewhere under maybe even 1%. So anywhere from 2% and down. So we're talking about a totally different level of fear or danger when it comes to coronavirus versus something like Ebola.
Let's see. Guys, ask your questions in here. We're going to try our best to answer as many as we can. Is asthma a risk factor since it attacks the lungs?
Any sort of underlying lung disease, whether it's COPD, emphysema, asthma, can put you at increased risk of being susceptible to any respiratory virus, whether it's flu or COVID-19. So yes.
Now, everyone loves their pets. What about pets and the virus?
Yeah, we talked about that too today. So there is no evidence so far to show that pets are in any way at risk to you of transmitting the disease.
Diane is asking, do you think this virus will shut down more schools?
I think that we may see more school shutdowns for sure. We've already seen it happen. And I wouldn't expect that we would not see more. I think certainly we will.
Let's see. Let's watch. Can you explain a little bit about making your own hand sanitizer? Because I know we reported this morning that stores are sold out online. The prices are outrageous at some sites.
Yeah.
What guidance do you have about making your own?
So I love this because I went to look for hand sanitizer yesterday. I couldn't find any of the small ones that I always carry in my purse with me. So you can make your own by taking 2/3 of a cup of rubbing alcohol, which is very easy to find normally, and 1/3 of a cup of aloe vera gel. Mix it together. If you want to add in a scent with some essential oil, just so it smells a little bit nicer, and that should make enough that you can fill little bottles, 2-ounce bottles with it, and have it without having to buy it from the store.
Rosalie's asking, do you think the warm weather will kill this virus in the summer?
There's some talk that there may be a seasonal association like we see with other viruses that kind of peak and ebb during different times of the year, but we don't have experience with COVID-19, so it's very hard to tell what exactly will happen when it becomes summer. We'll have to see.
All right. Can you get infected more than once?
That's another really good question that we don't know the answer to. So the presumption is that you develop immunity, some immunity to it, but the question is, how long does that immunity last? Does it last for a year? Does it last for longer or even shorter? We just don't have the answer to that question yet.
Does a air filter trap the coronavirus?
So some, we talk about sort of circulating air, and one of the things we didn't get to talk about today is the idea of opening windows and maybe using a fan to kind of disperse those droplets. And one other tip that we didn't give is the use of a humidifier. So humidifiers and keeping the air more humid has actually been shown with influenza in particular to potentially cause the virus to decay or to die quicker. Also, with increased humidity, the viral particles get a little wetter and heavier, so the droplets may actually fall to the ground sooner and just be less able to be infectious.
Are there any misconceptions about the virus that you'd like to talk about on here?
I think, again, the biggest misconception is that this is like a super deadly virus for everyone. I think there are people who are at risk, and for those people, we need to be really good about taking care of them, screening them, getting them treated right away. And those are people who are older than 60, 70, 80 years old, people with underlying medical conditions, who are either have cancer, immunosuppressed, cardiovascular disease, obesity, diabetes, underlying lung disease. But for everyone else, and in particular children, which I think a lot of parents are worried about, it does seem that the disease is basically mild in terms of the symptoms.
Diana Taylor's asking, one more question. Do you think it's silly to think about wearing gloves when you're out food shopping? Is that a good measure of protection?
Yeah, so we talked about the gloves before. I think if you're using disposable gloves like you would buy, you could potentially throw them away. But if you're using gloves that are not disposable, you really need to wash them because those droplets can get on the gloves and can still cause an infection. So, I think the biggest thing that we always talk about is just aggressive hand washing with soap and water and use of sanitizers.
How long should people wash their hands for? And
20 seconds.
What's a good tip to count those 20 seconds?
I usually tell my kids to sing the ABC song or Happy Birthday, which takes you through about 20 seconds.
Let's see. Are pregnant women more prone to the virus?
That's something else that we're still learning about, and we don't have a lot of data at this point. There was just a case that we read about yesterday where a woman delivered, and it seemed like the baby did not have transmission of the virus. There was no mother to fetal transmission, but I think we just need a lot more information before we can really comment on what the effects are in pregnant women.
Candace is asking, are there really 2 strains of corona? There was reports of possibly 2 strains.
I think we're going to be finding out more that viruses mutate and they change very quickly. That's just how they function in order to survive. So it would not be unusual as we go forward to learn about more than one type of strain.
Can a flu shot help?
Well, the flu shot is not going to help against COVID-19, but the flu shot's important to prevent you from getting the flu. The last thing that you want is to get either co-infected with the flu and COVID-19, or to get the flu and then be worried that you might have COVID-19. So definitely getting the flu shot is really important. We recommend that every year.
If you have little ones, kids, what do you recommend?
Kids it's so hard to have them keep their hands away from their faces, and they're like little, they're spreaders of, germs just by the way they are. So I think teaching them again about hand washing, keeping their hands away from their mouth, using sanitizers at school if they have that. But again, one reassuring thing for parents is that in kids, and we're still learning why, it does seem like if they get the infection that the course is relatively mild. In fact, there were 44,000 cases in China that they looked at, and of those cases, less than 1% were in kids that were under the age of 9, and there were no deaths in kids under 10. So just a little bit of reassurance for parents about kids.
Now, what if you're starting to feel some symptoms and you're not sure if you have coronavirus? What should someone do if they're watching this at home?
I mean, I think you can always err, to err on the side of caution would be to pick up the phone and call your doctor. We definitely are not advising people to go into the doctor's office because they could be contagious and spreading that to everyone else, or to run into an emergency room unless you're really sick and short of breath or decompensating in some way. But for everyone else with really mild symptoms, the easiest thing to do is to call your doctor and let them really assess what your overall picture looks like and what your exposure might be and what the epidemiology is, meaning what does it look like in your community? Is there a lot of spread there? In which case they might have a heightened concern that you could have been exposed.
We're still getting a lot of questions about traveling. People, they have a trip coming up. What should they do?
I think, again, this is really going to come down to a personal decision. My family, we had a trip planned in April that my husband and I just talked about yesterday. Should we travel on a plane with our kids? And we decided not to. Right now, I think we're learning more and more. I think in the next several months, we'll have a lot more information that can help inform us. But right now, where we still don't know a lot, I think if people wanted to err on the side of caution, obviously, it would be safer to not put yourself in a situation where you're in an enclosed space and could be more exposed. That being said, if you tend to be relatively healthy and young, the risk is probably very, very low. If you are someone who's older or has one of these other underlying medical conditions, the risk is probably a little higher. So I think you really have to sit down and weigh how important is this trip, how big are my concerns, what are my underlying risk factors.
Someone says, I may have some things being delivered from China, concerned it can spread through packages.
No, and that's been a question that we've heard before. There's no evidence to suggest in any way that you need to be concerned about packages that are coming from abroad.
Barbara's asking, how can an antibacterial sanitizer be effective against a viral disease?
Well, so sanitizers are effective against a whole host of bugs, so to speak. And so, those alcohol-based sanitizers, as long as they're over 60% alcohol, are effective against killing viral particles.
Someone says, should I clean my dog's paws? Do I need to protect my dog?
No, so far, if you are sick, we do suggest that you sort of self-isolate in your home, even from your pets, but also from other members of your family. So maybe keep yourself in one bedroom, don't share towels, don't share dishware, glasses and things like that. So I think isolating from everyone is a good idea, including your pet. But certainly there's no evidence to suggest that the pets can give you the disease.
What about concerts, big events? You're in a room with lots of people.
Same idea as the travel. I think, you have to make that decision based on who you are, what it looks like in your community. We're certainly learning that this is probably more widespread in the country than we even know. And as we start testing more and more people, we will find out more and more cases. So, I think this concept of social distancing is something that we're seeing a lot of other countries do very effectively. We're not used to doing that yet, but it is a public health measure that can be effective, both in decreasing your risk of getting the disease, but also decreasing the spread of the infection. And by slowing the spread, you're buying time. You're buying time for us to develop therapeutics and buying time for us to better understand the disease.
Should I disinfect my paper money?
Your paper money might disintegrate, so you may just want to wash your hands after you use money.
Clorox bleach for cleaning your household and other surfaces, are those good products to use?
Yeah, so we talked about today that the EPA just released a letter, a 5-page letter that documents every product that has been shown to be, or we think is effective against COVID-19. And on that list are multiple different types of Clorox products, Clorox cleanup with bleach, multiple types of Lysol products, as well as other brands.
What's the best website for people to get the most up-to-date information about this?
The CDC. I think the CDC is chock full of information. They're constantly updating it. There's all kinds of information about screening and treatment and just the disease in general and understanding it. I think one of the keys is information. And when you understand what's going on and you have more information, it does calm your fear and anxiety a little bit.
Is vinegar good for disinfecting?
So some people do talk about vinegar, but again, I think alcohol is really the one, alcohol-based products.
All right.
Focus on.
I'm still looking through these comments. We'll give it a couple more minutes. Let's see. Guys, ask your questions right in here. Anything you want to talk about or touch on that you didn't get to on the segment this morning, Tara?
No, I think, we again want to kind of decrease the level of panic and fear, increase the level of preparedness. And so we talked today also about the idea of keeping a stockpile at home of things that you might need if your doctor did tell you to stay home. So, whether that's non-perishable foods, whether that's prescription medication, and also making contingency plans, like if my kid has to stay home from school, who's going to take care of them? If I have to work from home, can I work from home? So really planning in the case or in the event that you do need to stay home will, again, make you feel a little more empowered.
We got another question about the masks, and some people are saying, should I wear the mask while I fly?
No, I mean, again, the masks, those surgical masks are meant to prevent you, if you are sick, from spreading your droplets to other people. They are not designed to keep out the particles from getting to you. They're just not a tight enough fit around the face. And so they're not an effective barrier. The N95 respirator masks, which some people are buying, are more effective at preventing viral particles from getting in. They're 95% effective in preventing very small particles from entering, and they're fit tested to your face. The problem is that what we don't want to do is take away the supply of an already limited supply of respirator masks for healthcare providers who need them. They're on the front lines fighting the disease and can't have a shortage of them for our hospitals who may be